I wonder how many of those able-bodied people on Medicaid struggle to find employment because they are ex-convicts. They've done their time in prison and they've been released, and now they're finding it to be a difficult task to find employment. You know, most employers these days run criminal background checks. Plus, many ex-convicts have certain limitations on the kind of work they can do or where they can work. For example, somebody on the sex offender registry can't work in a location maybe close to a school. And in many small towns, the school is kind of packed downtown area, often right around where a majority of the businesses are. Then you also think about the fact that some with a history of theft or drug dealing or other things might not be able to work in certain places. I know in a hospital, we would not hire somebody to work in a hospital with a history of drug addiction on their criminal record because of the risk of the kinds of medications that are around the hospital. There would be concern over somebody with a history of addiction stealing if they have a history of drug dealing. So there are these limitations that somebody has, and quite often what they end up with are minimum wage jobs that leave them still eligible for Medicaid health insurance. Then I think about volunteering. I've been a consultant, I've led nonprofit groups, and I will tell you this, nowadays, any nonprofit that is well established is not going to allow somebody to volunteer for them without a criminal background check. And if that criminal background check shows up any kind of criminal behavior, such as being a sex offender, having issues with theft, having issues with violent behavior, having issues with drugs, well, they're not going to be able to volunteer. So this is a question that I have. How many of the able-bodied people who are on Medicaid that are not working are ex-convicts? Maybe somebody can answer that question in the comments below. Thank you.